Hi there, viewers! Let's set the scene. It's just another ordinary day when suddenly, you get a call from a close friend. He tells you he's at the hospital. Nothing major, just a routine check for indigestion. But then the test results come back, and to your shock, the doctors reveal he actually had a heart attack weeks ago without even realizing it. Now pause for a second. How is that even possible? How can something as serious as a heart attack sneak up on you silently? Believe it or not, your body often whispers subtle warning signs before what doctors call a silent heart attack, and ignoring those whispers can be deadly. So today, we're diving deep into what a silent heart attack really is, the hidden signs most people miss, why they happen, and most importantly, what you can do to protect yourself. What is a silent heart attack? When you think of a heart attack, you probably picture a dramatic movie scene, someone clutching their chest, gasping for air, collapsing to the ground. But in real life, not all heart attacks look like that. A silent heart attack, medically called silent myocardial ischemia, often has minimal or no obvious symptoms. In fact, research shows that nearly 45% of all heart attacks are silent. That means almost half of the people who have one don't even know it's happening. And here's something even more concerning. Women are at a higher risk than men. Because the symptoms are subtle, they're often dismissed as something less serious, like fatigue, indigestion, or just stress. Why do silent heart attacks happen? To understand why, let's talk about what causes a heart attack in the first place. Your heart relies on a steady flow of oxygen-rich blood to keep pumping. But when cholesterol-rich plaque builds up inside your coronary arteries, it narrows the pathways. If platelets in your blood stick to that plaque, they can form a clot that blocks the blood flow. Without enough oxygen, your heart muscle begins to suffocate and weaken. That's the moment of a heart attack, silent or otherwise. The underlying culprit in most cases? Atherosclerosis, the hardening and narrowing of the arteries. And while lifestyle choices like smoking, unhealthy diets, and chronic stress make things worse, some risk factors are beyond your control, such as family history, age, diabetes, or even conditions like preeclampsia and complications from COVID-19. The warning signs you shouldn't ignore. Here's where it gets tricky. Silent heart attacks disguise themselves with vague, everyday symptoms. But your body does try to warn you. According to the American Heart Association, here are key red flags. Persistent flu-like symptoms. If you feel like you've had a lingering flu, sore throat, nausea, or fatigue, that just won't go away. It could be your heart asking for attention. Bloating and fluid retention. Swelling in your hands, feet, or stomach might not just be water weight. It could signal your heart isn't pumping efficiently. Unexplained sweating. A little sweat during exercise is healthy. But if you're drenched in sweat while resting or in a cool room, that's a problem. Heartburn or chest discomfort. A spicy dinner might trigger indigestion, but recurring chest pressure, burning, or tightness can be early signs of a silent heart attack. Radiating pain. It's not just the left arm. Pain can show up in your right arm, jaw, teeth, back, or stomach. This is called angina pectoris. Extreme fatigue and lightheadedness. Being tired after a long day is normal. But feeling drained for no clear reason, especially with shortness of breath or dizziness, should never be ignored. For people with diabetes, things get even more complicated. Diabetes can damage nerves, a condition called neuropathy, which dulls your ability to feel pain. That means you might not sense chest pain at all, making silent heart attacks even more dangerous. How doctors detect it. If you suspect something's wrong, doctors have several tools to confirm. Electrocardiograms, ECG, to read heart rhythms. CT scans and MRIs to check for damage. Blood tests for cardiac biomarkers, which are like little chemical messages your heart releases during distress. Stress tests and angiograms to see how blood flows through your arteries. Depending on the results, treatment could range from medications like aspirin or nitroglycerin, to surgical interventions like stents, balloon angioplasty, or bypass surgery. The silent danger after a silent heart attack. Here's the scary part. many people survive a silent heart attack without ever visiting the hospital. But that doesn't mean they're out of danger. A silent heart attack increases your risk of having another one by 35%. It can also lead to complications like cardiac arrhythmia, irregular heartbeat, stroke, or long-term weakening of the heart muscle. In other words, surviving the first one doesn't mean you're safe. Prevention, protecting your heart. So how do you lower your risk? Prevention is everything. Here's where small lifestyle changes can save lives. Stay active. Start with simple walks. Build up to jogging, yoga, or resistance training. Keep your heart muscles strong. Eat heart-friendly foods, high-fiber vegetables, omega-3 rich foods like salmon and walnuts, and fewer processed snacks. Swap sugary desserts for fresh fruit. Quit smoking. Tobacco narrows arteries and starves your body of oxygen. Cutting it out is one of the most powerful steps you can take. Manage key numbers. Watch your weight, blood sugar, cholesterol, and blood pressure. Keeping these under control helps stop plaque buildup. Reduce stress. Meditation, deep breathing, or even dancing can reduce the strain on your heart. Your goal? Keep oxygen-rich blood flowing smoothly through your body, every single day. Closing, call to action. Silent heart attacks are terrifying because they don't scream for attention. They whisper. But if you learn to recognize those whispers, you can act before it's too late. So ask yourself, when was the last time you got a heart checkup? If it's been a while, maybe it's time to book that appointment. And if you'd like to go even further, I've got more for you. Check out our video on 9 brain-boosting drinks. Or watch our guide on the top 10 superfoods for your brain. Because when you take care of your heart and your brain, you give yourself the best shot at living a longer, healthier life.